The care model innovation work is the model that will help us transform our clinics with the goal to become an accountable care organization and reliably meet the triple aim, which is to improve the quality outcomes, improve the patient experience, and reduce the total overall cost of care.
We provide the most expensive health care in the world, and yet our results on some of the basic measures of health of a population, we perform mediocre at best.
And it just isn't working. It's not delivering the kind of results or outcomes that we think are possible and that we know will really make a difference for patients' lives and that will help to control costs overall.
For years, it's been a circular argument that providers saying, well, we can't change the care until the payers change how they pay, and payers saying, well, we can't change how we pay until you deliver care, and so nothing changes. Fairview has put a stake in the sand and say we want to do something different. We really want to deliver better value to our customers, to the people who pay for health care, and to our communities.
We really want to be innovative. We want to be on the forefront. We want to be the best.
And it really literally only has to start with one person to get that foundation going.
To accomplish the amount of work we need to do to deliver that product more broadly, landed on a direction that would allow us to apply the knowledge and the strength of our 450 plus clinicians and 1,200 employees. And there are going to be times that we will want to turn back. I think at the end of the day, it will be a more fulfilling practice for our physicians, more satisfying for our staff.
CMI has radically transformed my relationship with my colleagues. I actually get to talk to them every day, all the time.
We have all these people with all their creative brains. If we can harness them all and apply them to these problems, there's no way we'll fail.
Empowering those frontline people to make the decisions and to act rather than being told what they have to do from guys like me.
From a pharmacy perspective, CMI is definitely going to improve patient care. It allows us to be more interactive with the providers, which I think is key to provide a complete care package for the patient.
It's the same stuff we've been doing, but thinking about it in a whole new way.
The CMI process allows people to experiment with some new things. It allows them to work together in different ways. It allows them to be more constructive and less destructive of one another, hierarchically and within the different nursing and medical disciplines, because the focus is all about the patient. And we have found that if you keep that as the focus, really interesting things happen. If people put aside their egos and their traditional boundaries, can really come up with new work to be done and new ways to work together toward a common goal, helping the patient.
When you empower your staff to think about things like improving the quality for the patients they work with every day, they come up with great stuff that you would never come up with as a provider.
CMI has increased our workload in the lab, but not a lot. It's something that we do as a regular routine thing anyway, just added a few more things to our workload, but it's fine.
In the past, some people say, well, my clinic is really 8 different silos run by 8 different providers. It turns out in a CMI world that really, there's no room for that.
With CMI, there's a sense that you aren't alone, that you have a team behind you, and that you're practicing together.
We knew that we may not get it right the first time, but they were there for us to help us get back on track and help us to do it right.
There is a lot going on with CMI. It is a lot to take in on every end, whether you're a receptionist, a phlebotomist, or a nurse. It's very hard at first, but it's very exciting.
We need to learn to trust each other that work that's been developed at another clinic that's working well for them, it's worth adopting and trying in a new clinic. We can't have a not invented here syndrome. That's what leads us to fragmented care that never gets better. There is a role for everybody within the entire Fairview system, and certainly within the clinics, to see that the work that they are doing contributes specifically to the success of our CMI rollout and our becoming an accountable care organization.
One of the true gifts of CMI is that it really does allow other people to use their gifts.
All the staff needs to buy in to do this work, mainly because this is the right thing to do. And it's kind of hard to argue with that. What we've learned tells us we're on the right track, and we'll continue to get better.
For a while anyway, we'll probably be benchmarking against ourselves. And in some ways it's very exciting because we're being pioneers. And we will be the benchmark for others someday.
My word for CMI is possibility.
Relationships. Innovative.
Invigorating.
Stimulating.
Flexibility.
Teamwork. Extraordinary. Exhilarating.
Powerful.
Transformational.
Fantastic.
Exciting.
Fulfillment.
Results.
Satisfaction.
Busy.
Awesome.
Here's a good one. I would say patience. You figure out how to spell it.